afternoon, everyone. My name is Lanicia Russ, and I'm the Executive Director of March for Moms. March for Moms, along with our partners, Donor International, For Care for Moms, Birth Mark Doula Collective, and the National Association to Advance Black Birth, are pleased to have you at our congressional briefing on cultivating equitable and culturally congruent maternal health care, the Kira Johnson and Perinatal Workforce Acts. In order to change the narrative of maternal health in the U.S., increasing access to maternity care, specifically culturally congruent maternity care and support, is key. With more than 1/3 of birthing people living in maternity care deserts, it is imperative that the U.S. invest in reaching birthing people in our country. Growing and diversifying the perinatal workforce will provide funding to increase the number of maternal health care providers, but also equip them to be able to provide culturally congruent care to the community they are serving. Another aspect of this is that there are local organizations across the country that are working tirelessly to provide services to birthing people with limited resources. Making investments in community-based organizations that are leading the charge to support moms provides them with the financial resources to continue serving their communities. In addition, supporting biases and racism training programs can add another layer to ensuring providers are practicing culturally congruent care. Lastly, promoting compliance and accountability programs in maternity care settings across the country can influence comprehensive, thorough care to birthing people across the U.S. The Kira Johnson Act and Perinatal Workforce Act can assist in accomplishing the goals needed to begin working towards ending the maternal health crisis by making investments into both community-based organizations and perinatal workforce workers. This virtual briefing will feature insights from maternal health care experts about the importance of policies and programs to best support and serve birthing people across the nation. I will now turn it over to Yulia Lapko, March for Moms Policy and Advocacy Director.
Thank you, Lanicia. I will go ahead and welcome our first speaker. His name is Jack DiMatteo, and he's a legislative assistant in the office of Congresswoman Lauren Underwood from the Illinois 14th District. He covers the Congresswoman's work on health policy issues, including the Black Maternal Health Caucus. He also works on Social Security, veterans, and foreign affairs issues in her office. He's a graduate of LaSalle University and received his master's degree in public policy at the University of Virginia's Frank Batten School of Leadership and Public Policy. DiMatteo started in Congresswoman Lauren Underwood's office as a 2019-2020 David A. Winston Health Policy Fellow, and he's from Deerfield, Illinois. We're really happy to have you, Jack, so go ahead and take it over.
Great, thank you so much, and welcome everybody. Appreciate you joining today. I'll try to be relatively brief with my update because I know you've got a lot of great speakers who are going to be talking about these two important bills, but I also wanted to extend the Congresswoman's gratitude to everyone who's joining, and of course for Lanicia and the March for Moms team for putting on this event and helping to build momentum for these two critical momnibus bills. I wanted to give a little bit of a status update on where we're at with the momnibus broadly and what it means for these two bills in particular. So as you might be aware, just a couple of months ago, the House of Representatives passed the first momnibus bill with unanimous bipartisan support. That was the Protecting Moms Who Served Act, which supports our pregnant and postpartum veterans. We've also seen some more recent momentum in the Energy and Commerce Committee. Two bills were advanced out of a health subcommittee with unanimous bipartisan support. That was the Maternal Vaccination Act and the Data to Save Moms Act. And the Maternal Vaccination Act will actually be considered in a full committee markup tomorrow, which means that if it passes again, it will then go to the House floor and could be our second momnibus bill to pass in the House of Representatives. So I think that this momentum is really exciting. It shows that there's an interest in taking on these momnibus bills. And most importantly for the conversation today, it shows that we've got a window specifically to advance the Kira Johnson Act and the Perinatal Workforce Act and make these really critical investments in community-based organizations, community-based perinatal health workers, and really ensure that pregnant people and new moms have the care and support they need before pregnancy, during pregnancy, labor and delivery, the postpartum period, and beyond. We also have really significant support from Speaker Pelosi, who said we must pass the momnibus, Leader Schumer, who just recently unveiled a 3-point plan to address maternal health. And point number one in that plan was to pass the momnibus. And of course, we've seen great engagement from the White House and support in the President's American Families Plan, which calls for a $3 billion investment in maternal health. And certainly love to see Momnibus policies like the perinatal workforce investments and Kira Johnson Act investments included within one of those recovery packages. So the final thing I'll say is this, which is that, one question that we get on these particular bills is, is anyone opposed? Do they have objections to specific points? And the reality is that we haven't heard anything like that. The big question is, how do we ensure that these bills are prioritized amidst all the different policy issues that people are talking about? How do we make sure that these investments are making it to the top of the list? And that's where your advocacy comes in, your voice comes in. By contacting your members of Congress and talking about why this legislation is so critical, it could really build the momentum that we need to get these added to the committee calendar, just like the other Momnibus bills that have already advanced, and hopefully get them passed, signed into law very quickly. So thank you again for all the work that you're doing. Thank you for your support on this legislation, and look forward to, hopefully adding some more co-sponsors to the bills after they get calls from you in the coming days and weeks. Thank you so much.
Thank you very much, Jack, and thank you for your tireless work on this amazing package. And we're glad to hear that pieces are moving forward, and that's the important part. So thank you for your attendance. I just want to let everybody know that we are taking questions in the chat for our panelists. So go ahead and write them in there, and we will have a Q&A segment at the end. I will go ahead and move on and introduce our next speaker that likely does not need a very big introduction. However, Charles Johnson will be speaking next. Charles is an entrepreneur and a really amazing advocate for change. He is a graduate of Florida A&M University and a native of Atlanta, and has spent his entire career working in many different areas, such as governmental contracts, global sourcing, and jointly owning a small business with his wife, Kira. After a sudden passing of his wife, Kira, due to complications following a routine scheduled cesarean, Charles became dedicated his life mission to launching For Kira for Moms Foundation. This nonprofit committed to reducing the maternal mortality rate and raising awareness about maternal death crisis in the United States, where we have over 1,200 women die annually. Currently, For Kira for Moms is working closely with congressional legislators to create legislation and mandate healthcare policies nationwide that will protect mothers and babies. And Charles will speak specifically on the Kira Johnson Act.
Thank you so much, Yulia. Thank you to everyone who is here participating today. Thank you to Jack. Thank you so much, Lanicia, for your leadership. And I have to really just send a huge shout out to the leaders of the Black Maternal Health Caucus, Representative Lauren Wood and Representative Alma Adams. And so it's my honor to talk to you all today about the Kira Johnson Act, which is named for my late wife, Kira Dixon Johnson. And so I don't want to be presumptuous and assume that everybody who's here today knows how I got to this point in advocacy. And so briefly, I'll share with you that my wife, Kira, we walked into Cedars-Sinai Hospital and we expected to be the happiest day of our lives on April 12th of 2016 to welcome our new son, Langston. And we walked into a nightmare. Kira was allowed to bleed internally for more than 10 hours while myself and my family begged for the staff at the hospital to take action. And our pleas fell on deaf ears. We were denied treatment. We were neglected, we were disrespected in ways that 5 years later are still beyond my comprehension. And so the reason that we are here and the reason why this legislation is so important is that no mother in our country should make the ultimate sacrifice giving the gift of life. And so I'm honored to be working in conjunction with all the dynamic leaders who have got us to this point for the Momnibus. I want to talk specifically about the Kira Johnson Act. And some of you all who've worked with me understand that protecting Kira's legacy is of the utmost importance. And so when we were working towards a bill that would bear her name, it was important that this bill would be substantive. It would push the envelope. It would call for things that would make substantial change in our communities and really truly reshape the face of maternal healthcare in our country. And so proud to talk to you a little about some of the key components of this piece of legislation. First and foremost, the Cure-Johnson Act is going to make critical investments by awarding funding to community-based organizations who specifically work to promote Black maternal health equity. Additionally, we're going to provide funding to implement training on implicit bias and racism for all employees in maternal healthcare settings. And last but not least, we're going to establish respectful maternity care compliance programs to promote accountability for hospitals and birth settings. And so for us, on behalf of the families that have been impacted by this maternal health crisis, although there's nothing we can do to bring these mothers back, as we're moving forward, it is critically important that as a country, if we profess to care about mothers, if we profess to care about babies, if we profess to care about the most vulnerable in our society, that we must make investments consistent with those values. And so I'm calling on congressional leadership to not only support and sign on to the Cure-Johnson Act, but to be loud and out front and vocal advocates of not only the Cure-Johnson Act, but all of the bills in the Momnibus. This should not be something that we have to scratch and claw for. Making investments to protect mothers and babies in our country should be a no-brainer. And I've said it when I was on Capitol Hill, I'm going to say it again when I'm here today with you all, is you might get asked the question, why is it that we need legislation specifically for Black mothers? And the simple answer is this, is that by fixing the maternal health crisis for Black mothers, we fix it for all mothers. I look forward to working with all of you all to continue to push for these bills. I'm so proud to hear the wonderful update on the progress and the momentum that we're seeing from leadership all the way from the White House, but it is time for us to apply even more pressure, to be more aggressive, and to make sure that the Cure-Johnson Act, along with all the bills in the Black maternal health Momnibus, become a reality. Thank you for your time.
Thank you so much for your continued advocacy, Charles, not just for the Cure-Johnson Act, but the Momnibus package as a whole. Next, I'm going to introduce our next speaker, Ebony Marcel. Ebony Marcel is the Director of Midwifery at Community of Hope that includes Family Health and Birth Center. Formerly the Administrative Chief of Midwifery Service at MedStar Washington Hospital Center, she completed her nursing education at Georgetown University and midwifery at Jefferson University. She is currently pursuing her doctorate at Frontier University. Last year, she was inducted as a fellow into the American College of Nurse Midwives. In 2018, she completed Duke University and Johnson & Johnson Nursing Leadership Fellowship. She is an adjunct faculty at Georgetown University and currently guest faculty at the Institute of Health Improvement, focused on rebuilding systems to address racism and health equity. Her advocacy work has included multiple congressional briefings, creating awareness around the need for policy changes to reduce maternity care disparities. Mrs. Marcel is known for her passion in midwifery and midwifery's role in reproductive justice. She has built culturally aware clinical models of care, specifically for underserved Black women. She currently serves on the following boards: the National Association for the Advancement of Black Birth, March for Moms, and is a collaborator with Black Mamas Matter Alliance. Most recently, she was appointed to the district's inaugural Maternal Mortality Review Committee. She resides in Washington, D.C. with her husband, stepson, daughter, and 2 fur children. Welcome, Ebony.
Hello. I thought I gave you the shorter version. I'm sorry, that one still seems long. I'm so happy to be here with everybody today, and thank you to everybody. Very excited to speak today, not only with Charles, but also Jack, and thank you, Lauren Underwood and Alma Adams, for all the work you have done to get this ball rolling with Black maternal health. And so today I'm kind of speaking more so as, you know, someone's on the front line, as a midwife and talking more broadly about cultural congruency and with the perinatal workforce. So just to kind of broaden that topic, it's not just midwives, but we're talking about doulas, we're talking about lactation providers, community health workers, um, uh, just peer support workers. All of those positions need more BIPOC providers, also Black providers. We also need to acknowledge the fact that even in the higher realms of medicine, we need more Black high-risk doctors and maternal fetal medicine, more Black OBs. BIPOC individuals still make up the smallest percentages in a lot of these professions that are caring for the perinatal workforce. So folks are distrustful. They're very distrustful of a lot of the systems that they're offered to engage in, and cultural congruency offers an opportunity for individuals and folks um, to be more at comfort. So what does that look like? So seeing someone that looks like you, we know can hopefully decrease some of your stress. You won't have to code switch, feel like you have to speak a certain way, worried about being judged. So really talking about how a lot of our systems are harmful. And I do also want to acknowledge the fact that we're talking a lot about the work on the individual level, but really important for us to really acknowledge that this is the systems. Because it doesn't matter how great of a job an individual does, if the systems are still inequitable, if they're still racist and still terrible, it doesn't matter how much an individual does. It's not going to help. Other things that I want to also kind of point out is thinking about when we're creating these providers to come and help in the perinatal workforce, having broader conversations about education programs and the challenges that BIPOC students are faced getting into programs, but also staying in programs, graduating from programs, microaggressions, macroaggressions, but also thinking about the finances to go to school, the finances to stay in school. Most individuals are career changers, established adults, they have bills, and would be an asset to the community, but are not able to afford going to school. There's also individuals that, you know, bullet and jumped in, came out of school with hundreds of $1,000s of debt. So we need programs that not only help to get folks into school, maintain them when they're in school, but also for all the folks that are out of school with a ton of debt. So making sure that we can also help them, because if these programs continue to be very, expensive, they come out of school, they are forced to choose jobs which are not likely in the areas where they really want to support just to pay off their large monthly student loan debt. So I just want to also point out, like, programs not only get into school, stay into school, but also for the folks that are trying to be, working in these communities, but are challenged with large amounts of school student debt. Other things that I want to point out really importantly is, again, talking back to, about what these systems look like. We still have a lot of barriers for our community health workers to work in a lot of systems. They haven't been embraced to the level that I feel like they should be. And I'm talking about the challenges that doulas are facing, especially now in the age of COVID and being respected to be supported for their patients. But we need to understand their role and how impactful they can be in helping the challenges that we're having in our maternity care system. So it's more than just the midwives, it's the doulas, it's the lactations, the community health workers, and they all need to be respected in their efforts and what they're doing to support birthing families in our country. And I think I've hit my limit. Sorry about that. Lanicia, don't kill me. Thank you.
Ebony, thank you so much. And thank you for all of your work in the community and being on the front line, especially the past year and a half supporting families. It's been really important. I will go ahead and introduce our next speaker and welcome Victoria Williams of Birthmark Doulas. Speaking of doulas, Victoria is a licensed master social worker, a doula, maternal child health consultant, and perinatal community health worker, as well as a program director. She is a highly dedicated and passionate mother of 3 girls with an extensive background within each of the aforementioned fields and fully enjoys being able to support, guide, enrich, and be present in the lives of families within the community so they can live prosperously during transformational times. Victoria was born in Birmingham, Alabama, and always admired to become a valuable resource that families and new mothers could rely on. Victoria has a proven track record of advancing public policy through her work as a member of the core team developing the Mama Plus Health Package, a policy-focused initiative aimed at addressing maternal health emergency and closing maternal health gaps for Black birthing people in New Orleans. The Mama Plus Health Package comprises local and state level policy, including 9 titles, and aims to address areas that most impact the health and birth outcomes of Black birthing people in New Orleans. And Victoria will be speaking again on the doula component of the Perinatal Workforce Act. Welcome, Victoria.
Thank you so much. Thank you so much for having me. Okay, so I now am the program coordinator for Birthmark Doula Collective, and this is a birth justice organization that supports, informs, and advocates for pregnant and parenting people in New Orleans. We offer doula services, childbirth education, lactation support, and we have several ongoing community advocate programs and projects monthly. We assist, our mission is to assist birthing people and their families in having the most empowering pregnancy, birth, and parenting experience possible. So, so many Black people and so many birthing people of color have lost their lives and sometimes their babies due to inadequate medical care. Bills like the Kira Johnson Act attempt to break these barriers. With an investment in community-based organizations like Birthmark Doula Collective, we can provide empowering, culturally relevant birthing services to birthing people who are Black, brown, of low income, in the same degree in which Birthmark is actively dismantling the way in which white supremacy and classism manifest within the collective. This is so important to us. Because community-based perinatal support programs and community-based healthcare providers are leading the charge in improving outcomes for Black women and birthing people. Investing in community-based organizations is a direct investment into the Black community and will save so many lives. As a collective, we offer doula services by trained professionals that provide non-clinical, physical, social, and informative support before, during, and after labor and birth. We provide a holistic approach that addresses various aspects of maternal health. As you see here, we have doula support, which is birth and postpartum doula support. We provide perinatal community health workers to all of our clients, which is a perinatal community health worker who is not only just doula trained, who is not only just trained as a doula, but they also have a certified breastfeeding specialist certificate, as well as a community health worker background. We have lactation counselors, peer counselors, certified lactation counselors, also internationally board certified lactation counselors. Every client that we see is also offered a nurse advocate. These nurse advocates monitor blood pressure and definitely focus on more high-risk patients. Investing in community-based organization implies a commitment to bring back the experienced community support that has been documented throughout human history. Community-based midwives, doulas, and other perinatal health workers that serve women of color are trauma-informed, and they are familiar with the people and able to affect change quickly. As we began to examine the increasing need for maternal care providers and non-clinical perinatal health workers, we offer culturally congruent support to women throughout their pregnancy, labor, and delivery and postpartum period. This table just shows the comparison of how much time healthcare providers spend with patients versus how much time a community-based doula spends with their patients. This is based on the community-based doula services nationwide. Research has found that doulas spend 6 to 11 times as much time, 6 to 11 times as much time with clients as do healthcare providers working in a hospital or clinical setting. Typically, a prenatal or postpartum visit for a healthcare provider lasts 15 minutes, whereas a community-based doula, they spend an average of 2 hours per prenatal or postpartum visit, usually in the client's home. In addition, doulas make themselves available via email, phone, text throughout the time they are supporting their clients. This is a big difference. Definitely in the time that we spend with their patients during labor and childbirth. Okay, unfortunately, the numbers, they hit home too. Here in Louisiana, we still have the same 3, 4 to 5 times now, more likely for a woman to die of childbirth than a white woman in America. These numbers are scary and it's a reality. Thinking about how these families are burdened with providing non-medical care to birthing family members, and sometimes cannot bear the burden alone. However, investing in diverse maternal care team, families will be able to relieve that burden. Also, as a goal, it is our goal to make sure that we keep our families and our birthing people, healthy and safe throughout their entire pregnancy, even after. So being able to have a doula, being able to have, congruent care or a continuous care throughout with the care team is important. It's everything. And like this article says, it is definitely all about their lived experience as being a Black woman in America. It has everything to do with that. As we see, the research has shown that doulas and midwives significantly improve maternal care, maternity outcomes. However, with an investment in a diverse team, families were able to just be able to see themselves during their birthing period. According to a 2017 Cochrane review, many other mothers report that the need for less medical interventions and increased satisfaction with the birthing process when using a doula. While midwives provide medical care during delivery, they can also provide perinatal care and monitor the fetus and encourage safe delivery. Also here, by having a doula, you are like 39% less likely to have a C-section. Even other studies have shown a lower rate of postpartum depression. So every birthing person and woman of color deserves to have the best maternity care. They deserve to birth their baby in a comfortable, sustainable, and safe manner without fear of losing their lives or the lives of their offspring. Presently, Black women and people of color, and they do not have this luxury as the system does not work in their favor. This is the subject that is born of racial bias by the healthcare system. Community-based organizations attempt to solve this problem by offering specifically culturally tailored and medically and non-medical care for pregnant women. Investing in our organizations will guarantee a safe birth and delivery for women and people of color across the nation. So take action, be a part of the solution, and support your local community-based organization. Thank you.
Thank you so much, Victoria and Birthmark Doula Collective, for serving birthing people in our state of Louisiana, which is also where I'm from. Next, we're going to introduce Nakia Lawson. Nakia Lawson is the owner and operator of Birth Blessings Professional Doula and Birth Services, referred to as Birth Blessings. Nakia's goal is to empower and educate women to know that they are divinely designed to give birth, to learn to trust their bodies and listen to their inner spirit as they embark on their birth journey. Nakia is a Dona International Certified Birth Doula, a Dona International Doula of Color Trainer Fellow, and a Dona International Approved Birth Doula Trainer. Nakia is also an experienced childbirth educator and has taught classes for various community groups and hospitals since 2007. To date, Nakia has assisted in the delivery of several hundred babies, supported more than 75 as an employee and women's health specialist for the city of Fort Worth, and over 100 families as a privately contracted community-based doula with the local county hospital in Fort Worth. As a donor-approved birth doula trainer, Nakia has supported the knowledge and careers of nearly 1,000 birth doulas and counting. Nakia has a Bachelor of Social Work degree and a Master's degree in Counseling Psychology. She also owns and operates the Natural Way Birthing Project, a local nonprofit organization focusing on infant mortality awareness and reduction in Fort Worth through social service programming. Nakia is also the mother of 2 awesome children and 1 beautiful grandchild. Welcome, Nakia.
Thank you so much. So I am just overjoyed to be able to be a part of this panel, as well as to share more information about how important the Perinatal Workforce Act, as well as the Kira Johnson Act, is to our birthing community. So I'm gonna start out with a little adage that my mother used to say when I was growing up. Life is about choices, and you have to deal with the consequences of the choices that you make. I say that to my kids, my nieces, my nephews, my grands, all the time. And if the US chooses to disregard the plight of Black maternal health, we will deal with the consequences of the continual rising maternal mortality and morbidity rates in America. I am Nakia Lawson, Dona International Board of Directors member, and shouts out to the Dona International Board of Directors, our Black Dona doulas, as well as those individuals who are out here serving what I consider on the front lines in maternal health care. I am also a certified birth doula, a birth doula trainer, a community childbirth educator, as well as a community lactation educator. I am pleased to present and share the importance of the growing perinatal workforce and support the workforce, the Perinatal Workforce Act and the Kira Johnson Act. Perinatal period is defined as relating to or usually a number of weeks immediately before or after birth. It is imperative that we have competent and relevant perinatal professionals to enhance the workforce and serve families to ensure positive birth outcomes during the perinatal period. According to the Centers for Disease Control, statistically, over 700 women die annually in the US from pregnancy-related causes. More than 1/3 of US counties are considered maternity care deserts, with no hospitals offering obstetric care and or 0 obstetric providers. That leaves more than 1 million American women living in maternity care deserts located in large metro and urban areas across the country. The Perinatal Workforce Act will provide funding for midwives, nurse practitioners, clinical nurse specialists, physician's assistants, perinatal health workers such as doulas like myself and all the other doulas in the communities, community health workers, peer lactation support and certified lactation consultants, nutritionists, and dietitians. This robust list of a mere cross-section of professionals that can support expecting families from the conception through the postpartum period and beyond. The funding that this bill will provide will grow and diversify the workforce with emphasis on culturally congruent care for marginalized and underserved communities. This is a revised overview that was originally provided in April of 2020 by Lauren Underwood based on the Black Maternal Health Omnibus Act of 2020. So we have a concept of who we need and why we need these professionals. Let's delve into how we introduce some of these individuals to the workforce. Since 1992, Dona International has trained and certified over 13,000 birth and postpartum doulas and currently has over 5,000 members worldwide. It is the world's largest and most reputable doula certifying organization on the planet. And I say it like that. As a birth doula trainer, having personally trained nearly 1,000 birth doulas through Dona International, I understand the value of competent and confident support for families as they navigate their birth experiences in and outside of hospital settings. I have served over 300 families as a birth doula and educated more than 3,000 families since 2008 in both community and hospital environments. When families engage perinatal health professionals such as doulas, childbirth educators, and lactation specialists, especially those who share their lived experiences, they are more likely to be compliant with their maternal health care needs. They're more likely to attend scheduled prenatal and postnatal care appointments. They're more likely to regard overall health and wellness and have more satisfying birth and empowered postpartum outcomes. Research proves that expectant families who have support of birth doulas are less likely to use medical interventions and pain management options during their birth or require a cesarean birth. Families who have the support of postpartum doulas are less likely to experience postpartum mood disorders, postnatal complications, what we call setbacks, and are more likely to initiate and maintain breastfeeding. I operate a community-based maternal health program in my local area here in Dallas-Fort Worth, Texas. The Natural Way Birthing Project is considered to be a kitchen table project. That's just me and a few dedicated volunteers who sit at a table and offer input on offerings that we can share with our public and our community at large. I operate and serve families on my shoestring budget to provide free, monthly, comprehensive, virtual, and in-person childbirth education classes and local affordable doula care and support referrals throughout my growing network of amazing doulas and other perinatal professionals across the globe. To any family in need of support, all they have to do is reach out and plug in. I have been able to provide community care through the support of community collaborators, grassroots funding, and community partners who believe in, fund, and support my work. And I do all this with limited funding and a whole lot of hard work, and along with the hard work and commitment. The Kira Johnson Act and the Perinatal Workforce Act will allow programs like mine to have access to sustainable funding to aid in expanding programming to serve more families, train more perinatal professionals, and build capacity for community organizations who are committed to serving marginalized and underserved families. Programs like Diversifying Doula Initiative in Lancaster, Pennsylvania, co-founded by Dr. Cherie Livingston and Patients Are Waiting co-founder, Dr. Sharice Hamblin. Together, two Black female OBGYNs started a community doula program designed to serve families in local hospitals in what I call small town USA, where they currently serve as clinical maternal health providers, helping coordinate support and care to families in Lidditz, Lancaster, and surrounding Pennsylvania communities. Programs like Healing Hands Community Doula Project in Austin, Texas, directed by Darlene Turner, whose mission is to reduce maternal mortality in Texas, amongst the nation's top 10 states with the highest maternal mortality rates, right here in the state where I live. And the Brooklyn Perinatal Network, coordinated by Rakaya Collins and directed by Denise West, whose aim is to partner doulas with community families and positively impact birth and postpartum wellness, where the Black maternal health disparities are some of the most disproportionate and the outcomes are the most egregious in New York State. That's right there in the borough of Brooklyn, New York City. Not to mention Tony Hill, a community midwife who operates the Mississippi Center for Birth and Breastfeeding Equity, serving families in the Mississippi Delta and regions of the state most affected by the maternity care deserts. These are just a few of the countless Black women-led organizations or programs serving marginalized and underserved Black, Indigenous, people of color populations. When we line up who we need to support our families, why we need them on the front line, what work is being accomplished and yet to be accomplished, and the fact that there are pockets of support needed everywhere in the country, from big cities to rural to outlying communities, we have to recognize the benefit and value of growing a perinatal workforce. There's a parallel to developing a diverse, competent perinatal workforce and creating better birth outcomes and sustainable programs. When we partner skilled birth professionals with families who are the most vulnerable to implicit bias and microaggressive behaviors during this perinatal period, we can shift the narrative around birth outcomes. We can prepare perinatal professionals with a blueprint to grow and expand how they show up for families. Professionals who can incite change, adopt best practices that grow healthy communities, and provide a positive return on investment for healthier families, especially amongst Black mamas and babies. These connections also lead to a long-standing career option and advancements for the healthcare system overall. We aid in developing a workforce of prepared, confident professionals who can establish a lifestyle, earning a living wage and serving their community. This is how we bridge the gap between for-profit and nonprofit birth support. This is how we become the change we want to see in our world. The Kira Johnson Act and the Perinatal Workforce Act helps us bridge the gap between the need and the resource. We as a nation of invested professionals can build capacity in communities that need to impact change for Black birthing people during the perinatal period. I fully support this legislation, and I am complete.
Thank you so much, Nakia, for that. You got a couple comments in the comment box as well, giving you some kudos. So right now we're going to go ahead and take a couple questions from our attendees today. So we're going to ask our panelists to turn their cameras on. And then Yulia and I will go through a couple of questions that you all received. And I will start first. We got a question saying, how can we continue to demand that the Omnibus Act is passed other than contacting our representatives and asking friends and family to do the same?
So it is important that we as individuals in our community get involved with what's going on in the legislative process, whether it be on the local level, the state level, or on the national level. It is imperative that you reach out to your representatives, send letters, make phone calls, get involved, go to your local representatives in their offices, meet them on the congressional level when they're in session. It is important that we consistently say the same message over and over again. We cannot water this down by tiptoeing around the fact that Black women, Black babies, and Black birthing people are dying. We're dying at a disproportionate rate, and we have to stand up to incite change.
Anyone else would like to respond to that one?
Nakia said it all. Nakia said it. Listen, what she said, every word of it.
Do you have another question out there?
Yes. So one of the things that has repeatedly come up is ways in which, how can the legislation that we talked about today help families in ways that we may not expect? And I know Nakia touched on that a little bit with the community organizing and the funding for community programs, but does anyone else have any comments on how either of the pieces of legislation can help families in ways that we may not expect?
I think the first thing that I think about is the racial bias training. I mean, that's not a way that you would necessarily expect or you can see on the outside, but it's something that the training is necessary because it helps the entire system. And that's what we're looking for, system change. While, lives are important, but the system needs to be changed completely.
I just would like to talk a little bit in specificity about one of the components of the Kira Johnson Act, and that is the establishing of the respectful maternity care compliance programs And so just for those of y'all who may not be familiar with these are, is that what we propose to do is establish um, essentially respectful maternity care compliance offices within hospitals that are independent from hospitals, right? And so essentially, as it stands now, as our system is set up now, if you're in a traditional healthcare setting and you give birth and you feel that you've been neglected, you've been discriminated against, you have experienced any of these things that so many mothers are experiencing, if you want to complain, who are you going to complain to? Who are you going to bring your grievance to? Somebody that works for that hospital that is going to assess your scenario and do everything they can to protect the interest of that institution, particularly making sure that your grievance does not turn into something that's litigious or a lawsuit, right? So what this will do is establish a mechanism for provider and system accountability that is easily accessible within these hospitals, that is independent from the hospitals. And so we're really hoping is by doing this, this will go a long way to transparency, because what we're going to do is we'll be able to collect the data for what's going on inside of these systems and then publish this data, right? And so not only do we hope for this to have extremely significant impacts on maternal care, but we hope to see this expand into all aspects of healthcare, to be able to have different and innovative accountability mechanisms that are easily accessible for patients to be able to express instances of bias or discrimination, and then have a mechanism to hold providers and systems accountable.
Great,
And
thank you.
we also have a question out there for Ebony. I didn't want to gloss over it. Currently, there are no midwifery programs at HBCUs. Will one of these bills be able to get infrastructure and funding for this?
I hope so. Absolutely. That would be the first place if I ever jumped into academia, I would love to teach. I think that this has been something that's been quietly touched on. But yes, I hope so. But I think the small amount, and when I say small, some may not seem like a small amount, but thinking about what will be needed to really implement this program and make it not only implement it, but make it successful, need more money. So yeah.
I think we have time for one more question, and this question is from Lexi, and the question is, are there any templates or handouts or tools available to be used in a meeting with our legislators, specifically to the Momnibus Act?
So I kind of responded in the chat. One of the good things about being affiliated with an organization like Donor International is that we have, through our advocacy department, created a legislative action toolkit. And that is accessible and available for individuals who want to have talking points and have a framework, and again, those templates to be able to utilize to go and talk to and speak with legislators as well as your local political advisors. That's helpful when you kind of want the words, but you don't have the words. You kind of know what you want to say, but it's coming from a place of hard work and not statistical as well as factual information. That's important, that when we go to our legislators, we come armed with facts, we come armed with the numbers as well as the stories that are being told, because we just can't come with what pulls on people's heartstrings. We've got to quantify this information with data that is collectively and effectively going to incite change. And so having something like a toolkit that you can use, that you can actually present to your legislator, as well as educate them on why the need is so great. It's more than just saying we're losing mamas and babies. It's more than just saying Black women are dying. It's more than just saying birthing people are having a hard time navigating the hospital system and the birth space. We have to put the legislative dollars and the action behind the activities that's going on the local level, the micro level in communities. This is macro change. We've got to be willing to make macro change, and using a tool like the Legislative Action Toolkit provided by Donor International can be very, very helpful.
Anyone else have any tools they would like to share? All righty. Well, Yulia, I'll let you go ahead and recap the issues.
Great. Thank you, Lanicia. Thank you to all of our panelists and speakers. This was truly amazing, and we thank you for your time and effort working on this great and hopefully continued moving forward bill package, the Momnibus. This entire briefing is recorded, and we'll be sharing that with you and our supporters. And any further questions from our followers and attendees, we can also go ahead and forward your way. So we thank you for your time. And Nakia made a great point, but I just want to plug a lot of our collaborators, maternal child health organizations have these tools and information under their advocacy centers. So whatever organization that is near and dear to your heart, my guess is that they will definitely have some advocacy resources. So just check out your organization's advocacy page on their website, whether that's a midwifery organization, doulas, physicians. We're all working together to advance these issues, and most of us have these resources available online. Lanicia, do you have anything to add?
No, I'll just go ahead and close this up since our time is coming to an end. So I just want to thank everybody for joining us for today's briefing. I want to send a special thanks to our partners, Dona International, For Caring for Moms, Birthmark Doula Collective, and the National Association to Advance Black Birth. We hope that you all learn more about the Kara Johnson Act as well as the Perinatal Workforce Act during your time with us today. And if there are any outstanding questions that may come to your mind after this wraps up, please do not hesitate to reach out to us at the email provided during your registration, info@marchformoms.org, and we will be sure to get your questions to one of these panelists. And I hope that everybody have a wonderful day.
Thank you.